You know that nagging ache in your neck? Yeah, that one. We all immediately blame our posture, right? But what if I told you the real cause isn't in your neck at all? What if it's part of a hidden conspiracy happening right inside your own body? Today, we're going to pull back the curtain on the real root cause of neck pain. Okay, first, let's just get a sense of how big this problem is. 86.8%. That is the percentage of people who will suffer from neck pain. I mean, just look at that number. That means almost 9 out of every 10 of us are going to deal with this. So no, this isn't some rare thing. It's practically a universal part of modern life. And look, this isn't just about a little discomfort. We're talking about one of the leading causes of disability worldwide. It messes with your work, it steals your sleep, it just gets in the way of everything. For millions of people, it's this chronic, exhausting battle that just never seems to end. So where does a problem like this even begin? Well, our investigation is going to start with let's call it a dysfunctional relationship that's happening in your back. A tale of two spines, if you will. Think about it. When your neck hurts, what's the first thing you blame? It's always posture, right? Slouching at your desk, doom scrolling on your phone. And yeah, that's definitely part of the story. But it's not the whole story. The real problem, the real starting point, is often much, much lower down. And this brings us to the usual suspect, the one we all know, forward head posture. You might know it as tech neck. Basically, it's when your head just starts to drift forward, out of line with your shoulders. And let's be honest, you see this posture everywhere. Okay, but let's talk about the physics of this for a second, because it's kind of wild. For every single inch your head moves forward, you're adding about 10 pounds of force on your neck muscles. So just 2 inches forward, that's like hanging a 20-pound bowling ball off your neck all day long. It's no wonder it hurts, right? But here's the twist. That forward head posture, it's often just a symptom. It's your body trying to compensate for a problem somewhere else. The real story, well, it involves a hidden accomplice, a stiff, locked-up section of your mid-back. And this right here perfectly illustrates that dysfunctional relationship. See, your mid-back, the thoracic spine, it gets stiff and restricted. It just stops moving the way it's supposed to. So to make up for it, your neck has to become hypermobile. It starts moving way too much to pick up the slack. And all that extra movement, that leads to strain, overuse, and yep, pain. Your neck is literally paying the price for a stiff mid-back. And listen, this isn't just some theory we cooked up. The data is super clear on this. In one study of office workers, they found that folks with mild pain had a certain amount of mobility in their mid-back. But the people with moderate pain, they had significantly less mobility. The connection is totally direct. The stiffer your mid-back, the worse your neck pain gets. The researchers themselves put it perfectly. They said that reduced thoracic mobility, which again is just our stiff mid-back, could lead to compensatory hypermobility in the cervical spine. So in plain English, a stiff mid-back forces the neck to do way too much work, straining all those delicate parts. The neck is paying the price for a problem it didn't even start. Here's a really simple way to picture it. Think of your spine as a chain, okay? Now, what happens if one of the links right in the middle gets all rusty and stuck? Well, the links above and below it have to wiggle and strain like crazy just to get the whole chain to move. Your neck, that's the link right above that rusty, stiff mid-back. All right, so we've found our accomplice, the stiff mid-back. But, every accomplice has a mastermind pulling the strings behind the scenes. So what's causing that stiffness in the first place? Well, that brings us to our next section, the weight of the matter. So the big question is why? Why does the mid-back get so stiff and immobile? I mean, sure, sitting all day is a huge factor, we all know that, but the research points to another and honestly an often overlooked driver behind this whole painful mess. And that overlooked factor? It's excess body weight. The science shows a really clear, really powerful link between a higher BMI and chronic pain. This is the mastermind, folks. It's what sets up the stiff mid-back, our accomplice, which then creates a victim out of your neck. So how exactly does excess weight pull this off? Well, there are a few things going on. First, it just increases the strain on your posture. Extra weight, especially in the front, pulls your center of gravity forward, and that forces your mid-back to round and stiffen up. Second, it promotes low-grade inflammation all through your body, which makes you more sensitive to pain everywhere. And third, it weakens those deep core stabilizing muscles that are supposed to be holding everything together. It's like a triple threat to a healthy spine. And you can see the direct result on the neck right here. The problem? Forward head posture.
The consequence? Way more muscle strain. The problem? Increased loading on your spine. The consequence? A higher risk of disc degeneration down the road. And finally, when your deep neck muscles get weak, the whole thing becomes unstable and, well, painful. Every single problem has a direct, painful consequence.
And the numbers here are, well, they're staggering. A major study found that individuals with morbid obesity are 254% more likely to suffer from chronic pain. Just let that sink in for a second. That's not a small jump. It is a monumental link between body weight and pain. Okay, so we've unmasked the accomplice, that's our stiff mid-back, and we found the mastermind, excess body weight. So in our final section, what does all this mean for actually fixing the problem? It means we have to look beyond just a stiff neck. And this really brings us to the most important takeaway of all. If your neck is just the victim in this whole crime, then treating the neck alone is never, ever going to work. Sure, stretching might feel good for a little while, but that pain is just going to keep coming back until you address the real cause, which is restoring balance to the entire system.
So what does a real path to relief actually look like? Well, it's kind of like a 4-step plan. Step 1, manage body weight. That reduces both the mechanical load and the inflammation. Step 2, improve mid-back mobility. We gotta unlock that rusty link in the chain. Step 3, correct your overall posture. This gets to the root cause of that forward head position. And finally, step 4, strengthen those deep neck muscles to rebuild stability right where it counts. You see? It's a whole system approach.
And the research is completely clear on this point. One huge review put it as simply as possible. Weight loss is a very important aspect of the treatment of pain. End of story. This isn't about how you look. It is a direct, powerful tool for getting a handle on this kind of chronic pain. So let's kind of bring this all together. The big idea here is to start seeing your neck pain as just the tip of the iceberg. Yeah, what you feel is the pain in your neck, but lurking right under the surface are the real culprits. A stiff mid-back, all that systemic inflammation, and a shifted center of gravity. Your neck pain is really just a messenger, and it's trying to tell you a much bigger story about your health. And that leaves us with one last, really important question to ask yourself. Is your neck pain really a neck problem, or is it a symptom of a much bigger system that's out of balance? Because understanding that difference, well, that could be the first real step you take toward finding lasting relief.